This medication is used to temporarily treat cough, chest congestion, fever, body aches, and stuffy nose symptoms caused by the common cold, flu, or other breathing illnesses. Guaifenesin helps to thin and loosen mucus in the lungs, making it easier to cough up the mucus. Dextromethorphan is a cough suppressant that reduces the urge to cough, and decongestants help to relieve stuffy nose symptoms. This product also contains acetaminophen, a non-aspirin pain reliever and fever reducer. It is not usually used for ongoing coughs from smoking, asthma, other long-term breathing problems, or coughs with a lot of mucus unless directed by a doctor. Cough and cold products have not been shown to be safe or effective in children younger than 6 years. Some products are not recommended for use in children younger than 12 years. It's important to carefully follow all dosage directions and not use this product to make a child sleepy. Always ask your doctor or pharmacist for more details about using your product safely. These products do not cure or shorten the length of the common cold and may cause serious side effects. Be sure to ask the doctor or pharmacist about other ways to relieve cough and cold symptoms, such as drinking enough fluids, using a humidifier, or saline nose drop/spray. If you're using the over-the-counter product, make sure to carefully follow the directions on the product package before taking this medication. Take this medication by mouth with or without food, usually every 4 to 6 hours as needed, or as directed by your doctor. It's important to drink plenty of fluids when using this medication, unless your doctor tells you otherwise, as the fluids will help loosen the mucus in your lungs. If you're using a liquid form, be sure to measure your dose using a medication measuring device or spoon. Do not use a household spoon because you may not get the correct dose. For some liquid products, you may need to shake the bottle well before each dose. Check the directions on the product package. The dosage is based on your age, medical condition, and response to treatment. Don't increase your dose or take this medication more often than directed without your doctor's approval. Improper use of this medication, abuse, may result in serious harm such as brain damage, seizure, or death. If your condition lasts for more than 5 to 7 days, gets worse, or occurs with a persistent headache, rash, or fever lasting more than 3 days, make sure to tell your doctor. These may be symptoms of a serious medical problem and should be checked by a doctor. Some common side effects of Robitussin severe cough cold flu 10 mg, 20 mg, 650 mg/20 ml oral liquid expectorants include dizziness, drowsiness, headache, nausea, nervousness, and trouble sleeping. If these effects persist or worsen, it's important to consult your doctor or pharmacist. If your doctor has prescribed this medication, they have determined that the benefits outweigh the potential side effects. While many people using this medication do not experience serious side effects, it's essential to contact your doctor immediately if you experience any serious side effects such as mental/mood changes, shaking, weakness, problems urinating, or irregular heartbeat. Although rare, a serious allergic reaction to this drug may occur. Seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you experience any effects not listed, it's crucial to contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. Acetaminophen is an ingredient in this product and taking too much of it can cause serious liver disease. Adults should not take more than 4,000 milligrams, 4 grams, of acetaminophen a day. People with liver problems and children should take less acetaminophen. It's important to check the labels on all your medicines to see if they contain acetaminophen, and ask your pharmacist if you are unsure. If you take too much acetaminophen, even if you feel well, seek medical help right away. Symptoms of an overdose include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing eyes/skin, and dark urine. It's also important to avoid alcohol while taking this medication, as daily alcohol use, especially when combined with acetaminophen, may damage your liver. It's always best to consult with your doctor or pharmacist if you have any concerns or questions about taking this medication. Before taking this medication, it's important to talk to your doctor or pharmacist if you have any allergies or if you are allergic to any of its ingredients. This product may contain inactive ingredients that can cause allergic reactions or other problems, so it's best to discuss this with your pharmacist for more details. It's also important to share your medical history with your doctor or pharmacist before using this medication, especially if you have breathing problems, diabetes, eye problems, heart problems, high blood pressure, kidney problems, liver disease, overactive thyroid, or trouble urinating. This medication may cause dizziness or drowsiness, and alcohol or marijuana can make these effects worse. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do it safely, and to avoid alcoholic beverages. If you are using marijuana, it's best to talk to your doctor. The liquid form of this product may contain sugar, alcohol, or aspartame, so if you have diabetes, alcohol dependence, liver disease, phenylketonuria, or any other condition that requires you to limit these substances in your diet, it's important to talk to your doctor or pharmacist about using this product safely. Before having surgery, it's important to tell your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this drug, so it's important to watch for fast/irregular heartbeat, dizziness, problems urinating, trouble sleeping, or confusion. During pregnancy, this medication should be used only if clearly needed, so it's important to discuss the risks and benefits with your doctor. And if you are breastfeeding, it's best to consult your doctor before using this medication. It's important to be aware of potential drug interactions when taking Robitussin severe cough cold flu. Certain MAO inhibitors should be avoided, and it's important to check the labels of all your medications to make sure you're not taking more than one product with the same ingredients. This medication may also interact with products that cause drowsiness, so be sure to talk to your doctor or pharmacist if you are taking other products with these effects. Additionally, this medication may interfere with certain urine lab tests, so make sure your lab personnel and doctors are aware that you are taking this drug. If someone has taken too much Robitussin severe cough cold flu oral liquid expectorants and has serious symptoms like passing out or trouble breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, while in Canada, you can call a provincial poison control center. Symptoms of overdose may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing eyes/skin, dark urine, agitation, confusion, hallucinations, and seizures. If your doctor has recommended this medication for you, it's important to follow their instructions and not share it with others. It's also important to keep all scheduled medical and lab appointments. If you are using this medication regularly and you happen to miss a dose, take it as soon as you remember. If it's almost time for your next dose, then just skip the missed one and continue with your regular dosing schedule. Avoid taking a double dose to make up for the missed one. When storing Robitussin severe cough cold flu oral liquid expectorants, it's important to keep it at room temperature and away from light and moisture. Avoid storing it in the bathroom and always keep it out of reach of children and pets. When it comes to getting rid of this product, don't flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard it when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.